Hello, everyone. This is Cole from the American Journal of Healthcare Strategy. I'm joined by an administrative fellow, Maggie. Maggie, please introduce yourself.
Awesome, no problem. Well, first of all, thanks so much for having me today. I'm really excited to get to talk to your listeners and share a little bit about my experience. But I could start us off with my background. So, I am originally from Long Island, New York. I grew up on the East Coast, and then I went to school down in Tampa, Florida at the University of South Florida. So, first, I received my bachelor's in health sciences. I did a dual concentration in biological sciences and healthcare management. At that point, I was kind of unsure whether I wanted to go more of the clinical, direct care provider route or if I wanted to go more of the administrative route. So, I figured a dual concentration would be both to kind of have a hand in each world and make sure that I've taken all of the necessary prereqs for postgraduate planning. Ultimately, I decided that I wanted to stay on the administrative side of healthcare. So ultimately, I stayed at USF and pursued my master's in healthcare administration, which I graduated back in May of 2023. Now I'm currently as an administrative fellow at UT Southwestern Medical Center here in Dallas, Texas.
That's excellent. The interesting part too, I think, is going right from that undergrad at the same institution to the grad school. I've seen that at USF a few times. It seems like people really enjoy the institution there, right? If they're staying for that many years, what caused you
Mm-hmm.
to want to stay for grad school in addition to undergrad?
Yeah, absolutely. So I really wanted to stay in Tampa. First and foremost, Tampa is a beautiful city. There's a lot to do kind of outside of the school as well. It's a great place to live. But in terms of USF, it's a really, really excellent school. The program itself at USF is great. We have a wonderful staff of very engaged professors. And luckily for students that did their undergrad, there's quite a bit of overlap between professors for undergrad coursework and graduate coursework. So in my case, I had an opportunity to take courses with some of the professors that teach the graduate program and kind of build some of those relationships early on and learn a little bit more about the USF MHA program. They also have a healthcare management student association where undergraduate students are encouraged to attend meetings and learn a little bit more about the MHA program. So, kind of through all of those different opportunities, I was able to learn a bit more about USF's program and ultimately decided that that was where I wanted to pursue my master's.
It's good advice for programs to invest in those associations. That is really important. So I appreciate you highlighting that. The East Coast is large, right? There's a lot of schools between where you started and where you ended up. So what was the
Mhm.
reason for going all the way down there to USF? What drew you there?
So, in part, it was due to family. My sister and I are 18 months apart. She's a year ahead of me. She had gone down there first. She went to the University of Tampa, which is about 20 minutes from USF. And my grandparents had moved down a couple years prior, so I had some family in the area. But ultimately, I was looking to escape the cold weather of New York and get my education somewhere where I can, enjoy the warm weather while also getting a great education.
Absolutely. That's excellent. Very nice. I think those are great reasons to head on down. And yeah, that's really great. And so I think it's interesting because it's caused you to kind of have experiences in a few different areas of the country, right? You've experienced the East Coast, and then now, of course, you're in Texas. Before that, though, during your grad studies, you took on a role of a medical assistant. And I want to ask, was that a full-time, part-time, and either way, how did you manage that with your graduate studies?
Yeah, of course. So I had decided pretty early on into my MHA career that I would have a little bit more of a robust education if I had some experience in healthcare. And it's one thing to kind of learn about healthcare protocols and processes in a textbook and kind of conceptualize what it's like. But I think it's a whole different experience once you kind of jump in and immerse yourself in those types of experiences. So in my case, I had applied around to a couple different practices, and I ended up getting a job as a medical assistant in private practice paid management. I was really transparent with the operations manager when I started that my goals were more administrative, but I think as an administrative leader one day, it's really important to understand what direct care providers go through and have a solid understanding of how clinic operations work and some of the stressors that happen in a direct care environment. So I was more than happy to kind of jump into one of those opportunities. And ultimately, I stayed as a medical assistant for about 9 months. I had an opportunity to work with 3 different pain management providers and occasionally float on over to the primary care practice and work with a primary care provider. So it really gave me, I think, a great supplement to my education that I was receiving at the University of South Florida.
I agree. I think that my time as a medical assistant in neurology was very valuable. Of course, you lasted about 2 or 3 months longer than I did there, so it was a good role. I also transferred more to the administrative side, and but it was a good role. How clinical was what you did as a medical assistant? Can you describe some of the duties a little bit, and then also how you got trained? So if I was maybe in your position in grad school again, and I wanted to get that medical assistant, license, or what is required, and how did you do that?
So, in the practice that I was at, you were not required to be licensed to become a medical assistant. Majority of the training was happening on the job. So, I was able to transition in pretty smoothly. In that particular practice, I trained for about 3 weeks before I was feeling confident to see patients on my own. At that particular practice, the scope of medical assistance was pretty large. We typically would, call patients, help check them into their appointments, escort the patient back into the exam room. We would pretty much go through the history and physical since their last appointment. If it was a new patient, it would be a little bit more extensive. If it was a returning patient, it would be a little bit more brief. Then we would do basic vitals such as, blood pressure, temperature, things like that. And then we would take that information and report back to the physician, join the physician back in the room with the patient, and then kind of function as a scribe. So it was really nice because you got to do some of the hands-on clinical work, such as vitals, helping with injections, things like that, that a typical medical assistant would do. But we also functioned as scribes as well. So it was nice kind of having, 2 types of experiences kind of combined into one. That particular practice also had the medical assistants responsible for all of the scheduling. So I was able to, do procedure scheduling or schedule for future appointments and things like that. And also after clinic was over, we would work on, helping out with procedure authorizations and any other side tasks that are pretty standard for medical assistants. So it was nice to kind of have both of those experiences combined into one. And then the operations manager, since I was transparent with her from the start that I was really interested in healthcare administration, she gave me opportunities to kind of work on projects with her that are with more of an administrative focus on the side. So once I was finished with my tasks for the day, I could stick around and help out with different projects that were going on, such as, Joint Commission preparedness for ambulatory surgery center and things like that. So it was really nice kind of getting a well-rounded experience while I served as a medical assistant. And also our operations manager was very flexible since she knew I was in school. So she allowed me to have some flexibility over my schedule. So I was able to work 3 days a week and balance that with my full-time coursework.
I laughed a little bit when you mentioned the JCO preparedness for those ambulatory centers, because I remember that kind of a nightmare a little bit.
Mm-hmm.
We had one of the instances, we had put signs up for COVID for masking, but they were paper.
Mm-hmm.
And JCO, as you might know, hates paper in the clinic because blood gets on and all these things. So it
Uh-huh.
was it was a nightmare. So that's very interesting. Do you feel like, because you actually got to see how an ambulatory care center was run behind the scenes, that it gave you a better appreciation for ambulatory care, especially since there's usually a big focus on hospital, medicine and hospital administration, and that's what a lot of people think
Mm-hmm.
of. They don't always think of the ambulatory side. Did it give you an appreciation for it?
Absolutely. I definitely developed a greater affinity for ambulatory care working through that experience. I also realized how convenient it is for patients to be seen at ambulatory surgery centers. and outpatient surgery centers in general. From a patient perspective, at least the ones that I had spoken to, they had always preferred to go to the ambulatory surgery center versus having to go to the hospital. Unfortunately, a lot of hospitals have to charge for parking, or you have to valet your car, or even just the transport of getting there can be kind of a fiasco, if you will. Versus an ambulatory surgery center, typically the parking is a lot more straightforward. Patients can easily flow in and out of the facility. They don't have to travel through the admission process of a hospital and navigate their way all the way back to a hospital OR. And honestly, the turnaround times are a lot quicker in some cases at ambulatory surgery centers, so patients can be in and out and not necessarily have to dedicate as much of their time and as much as their caretaker's time as well. So I really enjoyed that experience, and I think I learned a lot.
I think there's less fear too, maybe because I know,
Mm-hmm.
a lot, like my dad has like PTSD about the hospital, right? Like he has
Mm-hmm.
actual, traumatic symptoms about the hospital, and so I think that's a part of it. And I know insurance companies have been trying to leverage that as well for things like colonoscopies and routine
Yeah.
endoscopies. They're trying to, require that patients go to these surgical centers. So I appreciate you bringing that up.
Mm-hmm.
You had a year or two of experience, right, when you were finishing up your MHA. As you said, that's why you got that experience, is so that it would add to
Mm-hmm.
your the value. Why did you choose to then pursue an administrative fellowship? What got you on that search process?
Yeah, absolutely. So, in part, it was due a bit to the experience that I had working as a medical assistant. So, I worked for 9 months, and then I transitioned into a different role as the assistant to the operations manager at that clinic. And in that role, I really had an opportunity to wear lots of different hats, as you often do in smaller practices. So some days I was the supervisor, some days I was HR, some days I was marketing, recruiting, accounts receivable, credentialing, insurance verification. It really just depended on the day and kind of the needs of the clinic in that moment. And I was happy to kind of say yes to any task or assignment or project that came my way, because ultimately it was a great learning experience, and I felt really supported by the operations manager, and I could ask her any question that I had, and I always felt confident that she would be able to kind of help and guide me through any issue that I came through. So having that experience, it almost felt like a mini fellowship, because I got to try a whole bunch of different things and wear a lot of different hats. So coming from that, and then learning more about fellowship opportunities, I had figured, hey, if I can learn this much in a small private practice, imagine how much I could learn doing a similar type of experience where I spend time in a lot of different areas, but just at a health system. So that was definitely one of the factors that contributed to why I wanted to pursue an administrative fellowship. I also have some friends who had graduated from the USF MHA program a couple years before I did, and had pursued fellowship opportunities, and who had really spoken to the value of a fellowship. And I thought it would just be another great opportunity to kind of try out a lot of different things. And as an early careerist who didn't have really any experience in the inpatient setting, I thought it would be a great opportunity to see both inpatient, outpatient, and in the case of UT Southwestern, some academic and research components as well.
How many fellowships when you started doing that process? Because I know it's pretty extensive, right? We've talked to,
Mm-hmm.
about 50 or so, and all of them have agreed that it's a pretty extensive process. So how many did you decide to apply to, and why did you, choose that number?
So I ultimately applied to 14 fellowships. I did, when I had initially kind of combed through and created my initial Excel document of all of the opportunities I could potentially be interested in. In all honesty, it was closer to 20. But I decided to narrow it down a little bit and be a bit more realistic for me in terms of, opportunities. What are my priorities here? I think it's important when you're applying for fellowships to kind of have a set of criteria that's important to you. For me, a big criteria was geographic location. I love Tampa. It's a great city, but after being there for 6 years between my undergrad and my master's, I was kind of ready to try something new and expand my horizons a little bit. So I knew I wanted to leave the Tampa area. But again, I was not ready to run back to the cold of the East Coast. So ideally, I was, looking for systems that would be in the South. And I didn't want to be too far from my family, so I didn't want to go all the way to the West Coast. So geographically, I was somewhat limited. And I was targeting cities that I could see myself being happy outside of work as well, because I think that's really important, especially with a fellowship. If you're going to move somewhere and potentially, put down roots somewhere, I think it's important that you're happy with your life outside of work as well. So I based my decision heavily on geographic location. And then I had realized that I wanted to work for an academic medical center as well. I really feel strongly about the tripartite mission that a lot of academic medical centers have. I really enjoy the teaching environment of academic medical centers too. At least in the case of UT Southwestern, we're a teaching hospital, and that culture of continuous learning and education spans far beyond our clinical staff. We have lots of non-clinical programs that are centered around education, such as our administrative fellowship program. And it's really an environment where everyone is, happy to set some time aside if you'd like to talk through a problem or ask for advice or even just learn a little bit more about what they do. So as an early careerist who was, just starting out and looking for that next opportunity post graduation, I thought an academic medical center would be a really great place to land.
I have quite a few questions based on this excellent information you've given us, and I think it'll be really helpful to other people who are looking for fellowships. So,
Mhm.
one of the first ones, you explained well why you like the academic medical center, but how did you figure that out? Because I would never have known the difference 5 years ago, right? Where
Yeah.
I was. How did you figure that out?
Yeah, absolutely. So I set aside some time kind of as I was in that summer between first and second year, and I was, starting to fill out those applications. I spent some time researching the different types of institutions that are out there. What is an academic medical center, the difference between an academic medical center and maybe your traditional hospital, and just doing some research on my own to get a better understanding of exactly what an AMC is and what some of the benefits for working at an AMC are, and all of those different things. So a lot of it was kind of done through independent research and then figuring out kind of what resonated with me. When I was in grad school, I also had an opportunity to volunteer a bit at Moffitt Cancer Center. And while I was there, a family member of mine had actually been a patient at Moffitt and was enrolled in a clinical trial. And thankfully, he had fantastic outcomes through this trial, but kind of seeing that research translate into practice at Moffitt kind of sparked a bit of an interest in clinical trials and in healthcare research in general. So that also kind of geared me towards an academic medical center with a focus on research, because after seeing that incredible journey that my family member had had, I knew that I would love to work at an institution that's also, having a similar impact in the community.
Happy that your family member is doing well, and I've heard you'd be the third fellow that has mentioned Moffitt as being something that has kind of altered their career path. And so one of them, I think, went to work at the Dana-Farber Cancer Institute, and she was a fellow there. So it seems like I have heard that before, which kind of is very interesting. So great reasons on that, and great advice too, that when you're doing a research, there's multiple things you need to research, including
Mhm.
the type of medical center. And so I really appreciate you highlighting that. That's excellent advice. Back to the Dallas area, right? Talking about the city, when you were looking at Dallas, right, outside of work, what are some things that drew you to it, that made you think, I want to spend my next 2, 3, and maybe even longer there?
Yeah, absolutely. So Dallas in general is a growing city. So there's a lot to do. When I was looking at fellowship opportunities and I had kind of centered in on the Dallas area a little bit, I had learned that Dallas is one of, I believe, only 10 cities in the US that has all four pro sports teams. So if you are
Mhm.
a sports fan, there is plenty to do and watch around here. Kind of outside of that, Dallas really has a very diverse population here as well, which I enjoyed. It's very popular among early careerists as well. A lot of people will relocate here, after finishing their studies for work. Lots of large corporations and companies are headquartered down here in Dallas. So it definitely attracts talent from all throughout the nation, which was nice. There's lots of young professionals who are looking to build their career here in Dallas. From a healthcare standpoint, there are lots of fantastic institutions here in Dallas. So I knew it would be a great place to kind of build my career and a community that I really wanted to get involved with, since there are so many opportunities here. And I'm also a bit of a foodie myself. So I loved the pretty expansive restaurant scene that we have here in Dallas. Any type of cuisine that you could really want, we have. And then there's also a mix of, art and nature and museums here in Dallas as well. So no matter really what your interest area is, you can definitely, find what you're looking for here in Dallas. Also, it's a very popular city for concerts and live music as well. Lots of artists come through Dallas either on their way to Austin or heading somewhere throughout the country. So any type of music, you'll be able to find an artist performing here. So overall, there's tons to do here in Dallas.
That is a great rundown. I have never been to Dallas, but I'm gonna have to go and check it out, especially with those that the four sports teams. I think that's a good point because it really does change the environment of the city when
Mm-hmm.
there's so much action going on and people get really wild. So that's excellent. I appreciate you sharing that, and it helps other fellows who might be interested in that kind of an active lifestyle to go to it, or others to avoid it, of course, so that's not what they're looking for.
Yes,
Um,
yes.
so I appreciate that. And then, so talking about UT Southwestern specifically, how has your experience been there? What is the culture like? And can you just give us an overview too on the fellowship structure? You said it's an 18-month, but you were also talking earlier about how there are some interesting like interim manager arrangements that go on. So if you can just give us an overall rundown, that'd be great.
Yeah, absolutely. So I can talk a little bit about the structure of our program, and then I can give you how my experience has been so far. So we are an 18-month fellowship program. So how our program works, we have 14 of our core operational rotations that all of the fellows complete. So those can range from, transplant, women's services, non-clinical support services, the cancer center, neurosciences. There's an entire range which focus on our operational service lines. And then towards the end of our fellowship, we each get to go back and choose an elective rotation. So you can either choose to circle back to a rotation that you've already completed if you really enjoyed it and you want to spend some more time there and learn a bit more, or you can choose to rotate to an area that's outside of our core operational areas. So, for example, if you wanted to rotate through development or HR or strategy or something kind of outside of the traditional operational realm, you can absolutely do that as well. So, that's a really great opportunity that we're given as fellows. And then the last portion of our fellowship, we do an interim management experience. And that is typically 3 months in length. And each of the fellows is placed in a vacant either manager or supervisor position somewhere within the health system. And that's a really great opportunity for fellows to get to try out people management and ultimately decide if that's something that they'd be interested in pursuing post fellowship. The idea for interim management kind of stemmed from feedback from our steering committee and from some of our preceptors that we have at UT Southwestern that work with fellows pretty often. Typically, after fellowship, they would report, fellows have great institutional specific knowledge and they have, great experience and they've built, wonderful connections throughout the institution and great technical skills. But one thing that the fellows are, have historically lacked was people management experience. So when they transition into a people management type of role, they have a bit of a learning curve there. So to try to fill that gap, they built in that interim management experience. That way you can try out your hand at people management before you finish the fellowship and also while you're still in that supported environment. We also, when we're completing that experience, we have weekly one-on-ones with our director. So that way we can, frequently touch base with her and kind of talk through any experiences that we may be going through as interim managers. She had been a clinic manager herself prior to her current role. So she has lots of great insight to help fellows who are kind of in that, first people management type of experience. Our program also assigns each of the fellows two mentors within the institution. So it's great to have that people management experience and have two more seasoned individuals in the institution who are people managers to kind of bounce ideas off of and ask for advice if you may need that.
Wow, that is very comprehensive, and I appreciate that they really seem to really care about the outcomes. Like
Mm-hmm.
that's I mean, not that other fellowships don't, right? But the fact that they're really making these adjustments and they're putting so much resources behind it seems like they care about you being there long term. Is that something that you felt during your experience?
Oh, absolutely. I think that's one thing that really stands out about our fellowship program. The word I would use to describe it would be intentional. There's tons of intention put behind our fellowship program, from even the most basic, like the order in which we complete our rotations. Like, it's built so that you start with some of the most foundational. So that way, as you continue to rotate through, you can kind of build upon the experiences that you've already had and the connections that you've already built. I think a big reason why our fellowship is, able to improve year over year, and we're constantly working to make it the best experience possible for fellows, is because of our program director. Her name is Sasha Minasharipur. She was a past fellow herself, and she has done a lot of the work in kind of redesigning our fellowship program and building upon it year after year. She's the director of university hospital program operations. So she oversees the administrative fellowship program and our administrative internship program. She also functions to support our chief operating officer, who's the executive sponsor of our program. But in that specific role, it's really, really nice at UT that the fellowship program is actually built into her job description. At a lot of other places, I've heard that fellowship programs are kind of an additional responsibility of someone, not necessarily built into their job description. But at UT, they really value the fellowship program, so it has been, formally built in. That way, our program director has the time, the resources, and the energy to be able to, really dedicate herself to the program and to constantly improving it.
That's a really good point, and I appreciate you giving that advice to other programs too, and how they can improve, because you don't necessarily want the fellowship to be like a hot potato among the executives, right? Where
Mm-hmm.
everyone is in a crisis, and you also don't want it to be the first thing that gets chopped when the hospital goes through a hard time,
Yeah.
right? And that does happen, and so I think that's excellent advice for the system. uh, from the beginning onboarding process, and this will be my final question for you. I do appreciate your time very much. What have they done to make you feel at home, I guess is the best word? Is there anything other programs can do to imitate, or other people can do, your co-fellows, to make you feel at home there, that we could, maybe improve on?
Absolutely. So from the start, UT in general, the culture is very, very welcoming. I'm not sure if it's really a Texas thing in general. The reputation of people in Texas is that they're extremely friendly, and I have found that to be true, at least in my experience, and especially at UT Southwestern. From the start, the leadership team that we work with has made it very, very apparent that they are, very excited to have fellows and that they really value the program. We're given tons of support, lots of touch points with our program director, with our preceptors, and also among our cohort. We have biweekly meetings as a cohort to just kind of touch base and say, hey, what's going on? Is there anything that I can do to support you? What are you guys working through right now? We can also give each other advice on, hey, I just completed this rotation. This is what you can expect. Or this was a really great experience that I had here. You should try to do that when you go there. So it's nice. We had lots of opportunity to kind of build that camaraderie amongst each other. Fellowships are, often kind of a niche job in the job market. So it's really great to have other people that are kind of going through the same experience that you are, and who can really relate to some of the, challenges of being a fellow. So it's really awesome that UT gives us a lot of time and support, and also gives us opportunities to bond amongst each other. when we first started in the onboarding process, they had a wonderful luncheon for the fellows. They invited all the members of our steering committee who we had interviewed with when we were going through the application process, many of which now serve as mentors to us. They gave us a very extensive campus tour, so we got to spend pretty much an entire day just trying to find our way all around campus. Our campus is about a mile by a mile, so it's quite large. So definitely was important to make sure that we covered all of our ground. But overall, UT Southwestern did a fantastic job of welcoming us into the institution. It's also helpful as we're an 18-month fellowship and we have 6 months of overlap with our senior fellows, as we call them. So they served as, informal mentors for us and a great resource as we were getting, oriented and onboarded to UT to kind of answer any of those questions that we had. They made themselves available, whenever we needed them, and made sure that we were frequently touching base. We also have a biweekly meeting as a fellow cohort with our program director. And in those meetings, we will typically, do a round robin. Everyone will share, what's going on in their slice of the institution. And then we'll also be able to feature different guest speakers from the institution who we may not typically interact with in our operational rotations. And then we'll also have opportunities as fellows to present on topics that are assigned by our program director. So overall, lots of support, and we were really given a very warm welcome into UT, which I'm very grateful for.
Wow. Yeah, a lot of investment and a lot of advice for other programs, people who might be looking to start a new fellowship program as well. I really do appreciate that. So it sounds like just an awesome place to be a fellow. So I definitely encourage people to apply. I'm sure you guys probably get lots of applications though, but we do encourage people to apply. Thank you so much for coming on this evening, Maggie. I think you're in Central Time, right?
Yes, I am.
It's just 5:30 there right now, so just the end of the day. So I do really, really appreciate it, and I hope you have good evening, and we can, stay in touch and have you back on in the future.
Great. Thank you so much. And thank you again for, inviting me onto your show and allowing me to speak with your audience. If anyone has any questions or wants to further discuss the fellowship program at UT, I'd be happy to jump on a call or answer any emails or messages that you may have.